Okay, I'll bring this meeting to order for the Homes Committee of Management meeting of August 12th. Next on the agenda is approval of the agenda.
Resolved that the agenda for the August 12th, 2025 Homes Committee of Management meeting be approved as presented.
Mover and seconder, please. Council Noble, Deputy Warden Ketchba. All in favor? Motion carries. Adoption of the minutes.
Resolved that the minutes of the meeting held on June 10th, 2025 be adopted.
Mover and seconder, please. Councilor Latham, Councilor Hance. All in favor? Motion carries. Any disclosure of peculiar interest or general nature thereof? None. We have no delegations. Down to report 6.1, Homes Committee Management, Long-Term Care Operational Report. Go ahead, Michelle. Welcome.
Thank you, Mr. Warden. Through you to members of the committee. So today's PowerPoint presentation is in addition to your two reports included in your package, the director's update and the operational report. And it's for the time frame of April to June of 2025. Next slide. This covers off the agenda, 6 agenda items. And the next slide is an update on our inter-ride long-term care facilities. You've heard me speak about this a few times. So we are now doing our training from July to September. That includes weekly meetings with our webinar meetings with the ministry and community practice meetings. And we do go live October 1st of 2025. So we're preparing readily for that. Next slide. There's a number of funding updates for the committee today. The first one is level of care funding. So when we do budget planning for the homes each year, we have to forecast or guess or anticipate what that level of care funding will look like for the upcoming year. And so for this year, we received communication that it's a 2.1% increase. We did budget 2% across nursing and personal care, program and support, and raw food. So when we did the calculation of what we actually received, it works out to an increase for the 2025 budget of $99,050 across all 3 of the homes. So that's the impact of that level of care funding increase. We also received communication about our case mix funding methodology. All long-term care homes received that. And so that increase that we received is also included in that $99,000. The next slide. So you hear me saying case mix index and CMI. That is a score that's based on those assessments that we do every year. And that's how our level of care, that CMI score impacts significantly our level of care funding. So the provincial average I've got there for you is 1.0223. Our 3 homes score is significantly higher than the provincial average, and I've got them listed there for you. We range between 1.09 to 1.17, and those are like the top 10 in the percentage in the province. So we're doing really well. Why I'm pointing that out to you today is that with the transition to the Inter-RAI LTCF, we're now frozen with our CMI score. So we're really pleased to see where we are with those scores. That means that our MDS-RAI staff and our registered staff and anyone who touches those assessments is doing what we need them to do to secure the most benefit of the funding. Next slide. I just wanted to give a little update. You've heard me talk about PREP funding over the last couple of years. Our homes do apply for this funding. It supports our clinical placements for nursing students and PSWs in our homes. With this funding, we can receive support from an engagement liaison. We can backfill our frontline staff when we have students, not all of the time, but for some of the shifts, we can backfill their shifts and be paid reimbursed for their hours. We can have support for our student placement coordinator role, which is part of our education role. So all 3 of our homes did apply again for year 5, and we've each received $50,000 for each of the 3 homes to support this work that we're doing. Additionally, our homes staff can take a preceptor education online course, and we're reimbursed $210 for each of the staff's wages and benefits to support that training. And this past quarter, we did have 15 clinical placement students across the homes. Next slide. There was a memo in June of this year which spoke to 3 or staffing programs, funding related. The first is the long-term care staffing increase funding. This is funding that we anticipated to receive, and so it was included in the 2025 budget. This supports the direct hours of care funding, the target of 4 hours per resident per day. So we did receive the funding that we had put into the budget, so that's a good news story. And the next slide is the personal support worker permanent wage enhancement. Again, we anticipated this funding. It was part of the budget, and we received communication in June that that would be continued. I have supporting personal growth funding. That's a typo. It's supporting professional growth funding. Sorry about that. And again, we also included that in the budget and anticipated those dollars. So again, just the ministry communicating that that funding is flowing through. The next slide speaks to our accommodation rates. Those are set by the Ministry of Long-Term Care every year. And so this year, they've recommended a 2.4% increase. So that increase is effective July 1st. And that's basic for a basic bed, that's $1.61 per day increase for each of the residents in the homes. Just a short update on our clinical pathways work. So again, this is the implementation of standardized evidence-based clinical support tools, part of our RNAO best practice spotlight work that we do. Year 1 is now complete. We already had an admission assessment, but we updated that to align with the recommended standardized assessment. We introduced a delirium assessment, and we're already pleased to be able to report that we have had some positive outcomes by implementing the delirium assessment. We've identified deliriums earlier than we may have done otherwise. And also the resident and family-centered care assessment is new, and that has supported care planning for our residents. We went live with those assessments in April of this year. There were a few glitches in the software, but it's flowing very well now. And the next slide. Year 2 focus is on falls and pain. And so the preparatory work began in June. We're reviewing policies. The staff are doing training in the point-click care sandbox, and we will go live November of 2025 this year. When I talk about falls and pain, if you looked at the operational reports included in the package, you'll see there was a number of quality indicator data. So we had falls, restraints, pressure ulcers, and antipsychotics without a supporting diagnosis. I had listed percentages there, and those percentages relate to the percentage of residents for that specific time frame. With our education coordinator role being implemented in 2025, our quality improvement role is now separated from the education role. And so the goal is to have our quality improvement coordinator come in 2025, at least annually or twice a year, to provide a more wholesome report on all of the quality indicators that we do monitor and report through CIHI. Next slide. The last quarter, you might recall that we had applied and we were successful with some funding for diagnostic equipment. And so this particular quarter, we were successful in implementing the skin and wound software application and the vital signs equipment and software. Really good news for our registered staff. These tools are integrated with point-click care. It has really streamlined our processes and reduced duplication of work, standardizing our assessments, and giving our registered staff more time at the bedside with our residents. The next slide. 2 policies and procedures were updated this quarter. The transfers and transfer assessments was updated to incorporate resident and staff safety requirements. The plan of treatment for CPR was updated in collaboration with both legal and our medical directors to reflect current legislation for situations when CPR is not being offered by the physician. And the next point there is the PrEP, which I've already spoken to, and CLRI, which is the Center for Learning, Research, and Innovation. I mentioned the online preceptor education opportunity for our staff. We've already had 30 staff in the past quarter who participated in that training Not only does it support the clinical placements that we have in our homes, but another goal from our perspective is that this work will support new staff onboarding orientation process. So we've already begun to partner with some other homes that have developed a coaching program and are implementing that work in their homes. You might have noticed in the operational or the director's report, I shared a memo from the Ministry on the Healthcare Staffing Agency Report Act. And so this is sort of around recruitment. So I just wanted to speak to that point. We currently do not use staffing agencies. We used a staffing agency for a very short period of time during the height of the pandemic for about 3 to 6 months. But this is still a good initiative. If we ever need to consider that in the future, there is this act should support stabilizing those agency rates and providing some cost certainty for individuals that need to utilize that service. Next slide. As always, I'm sharing the Ministry of Long-Term Care inspection results. So we did have 3 inspections this quarter. Beaubier Villa did not have any inspections. Elgin Manor had 2, one in April for a critical incident, and there were 2 written notifications issued, both related to policy violation. In June, we had an inspection at Elgin Manor related to concern about visitation, and there were no findings of noncompliance. Terrace Lodge, next slide, had an inspection related to a critical incident and an anonymous complaint related to insufficient staffing, and there were no findings of noncompliance with that report. We also had a couple of visits from the Ministry of Labor. They were out to Beaubier Villa 2 times, once for a concern regarding an odor from a servery drain. There were no orders issued. Staff conducted some assessments and implemented some measures, and the ministry did a follow-up visit in May. Again, no orders were issued. Elgin Manor had a visit from the Ministry of Labor as part of the norovirus outbreak at Elgin Manor because there were a number of staff that were impacted. And again, no orders were issued. Next slide. Southwestern Public Health regularly does inspections of our dietary services. So they were out to Beaubier Villa in May, and there was one finding of non-compliance with a small amount of ice buildup in the walk-in freezer and a small amount of buildup beside the oven, and both of those were immediately addressed. Terrace Lodge also had an inspection in May, and there were no findings of non-compliance. And I always like to share some home highlights. So Easter was definitely celebrated across the 3 homes this quarter. So the Easter Bunny visited and received some hugs and embraces at Beaubier Villa. Next slide. Strawberries were a hit, of course, this past quarter. So here's Beaubier Villa having a strawberry social. Number of outings, of course, at all of our homes. The Beaubier Villa residents actually made it down to the Rosie Rhubarb Festival and did some dancing and shopping. And of course, pet therapy remains a big hit at across all 3 of our homes. One of the events that Beaubier Villa did, they actually pulled everyone together for a group shot. So this is a wonderful event that they held, and they had entertainers as well as the staff pull together for a group shot. Everyone looks very happy there. At all of our homes, we have a few staff that actually provide entertainment for our residents. So this is our maintenance and housekeeping staff providing some entertainment for our residents. And more Easter smiles. This is at Elgin Manor, having a good time with their photo op. Of course, Father's Day was celebrated across all 3 of our homes, and we have Supermen dads at Elgin Manor, of course. So there we go. Elgin Manor did participate in the Walk for Alzheimer's at Pinafore Park this year. And so it was residents and staff that participated, staff across all 3 departments. It was a coolish day, but they survived their walk, and being the year 2025, they actually raised $2,025 for Alzheimer's. So that was a great initiative on their part. Here we're showing a picture of an amazing couple celebrating their 76th anniversary on the left. And we always do try to make a big deal for help our residents celebrate their birthday. So One of our Algamana residents looks in awe that she's being honored for her birthday. More strawberries, and it doesn't matter what kind of produce it is, our residents like to get in there and do some work and help preparing where possible. Over to Terrace Lodge. So we have a couple of new leaders at Terrace Lodge. On the left-hand side, we have Lisa Zinkin, who is a long-term PSW and then moved into an RPM position at Beaubier Villa. And she has done the MDS RI work and BSO work and just was a great candidate to promote to the resident care coordinator role at Terrace Lodge. She's doing an amazing job and has settled in well. On the right-hand side, we have Leanne McKeefer. She's our newest addition to our leadership team. Leanne comes to us with many years of long-term care experience across Ontario and BC, as well as doing some management work. So she's just starting to settle into her role. Again, more Easter activities, this time crafts at Terrace Lodge. And this is, of course, Mother's Day is celebrated across all three of our homes, but this is just a beautiful picture of smiles celebrating the moms at Terrace Lodge in the new event space. And Terrace Lodge had coffee with a cop for an afternoon. And so the residents thought this was a really cool opportunity, as did the officer. And on the right-hand side, that particular day, a couple of former registered nurses from Terrace Lodge, who are now volunteers for the auxiliary, were serving from the tuck shop that day. More strawberries, of course. And that concludes the presentation. Lots of information in the package in those reports, but I'm happy to answer any questions you may have. Thank you.
Thank you, Michelle. Any questions or comments for Michelle? Oh, go ahead. I'm in a hurry today. Yeah. Yep.
Resolved that the report titled Homes Committee of Management Long-Term Care Operational Report, April 1st, 2025 to June 30th, 2025, from the Director of Homes and Seniors Services dated August 12th, 2025, be received and filed, and resolved that the report titled Homes Committee of Management Long-Term Care Directors Update, April 1st, 2025 to June 30th, 2025, from the Director of Homes and Seniors Services dated August 12th, 2025, be received and filed.
Any further discussion? All in favor? Motion carries. Thank you, Michelle. Moving through the rest of the agenda. Really nothing until we call the chair for the next management meeting. So adjournment.
Resolved that we do now adjourn at 2:53 PM to meet again at the call of the chair.
Mover and seconder, please. Counselor Hance, Counselor Jiguer, all in favor? Motion carries.